entitled Aging Together, Building Connected Communities in European Rural Areas. I have to tell you that this webinar is being recorded and will be shared. So if you wish to turn off your camera for that reason, you're of course welcome to do so. I am Alexandra Iagil. I'm the thematic coordinator for employment, entrepreneurship and inclusion at EDOL, the European Association for Innovation in Local Development, and I'll be moderating the webinar today. Today's webinar is a part of two initiatives. It's part of the EU-funded SERIGO projects, in which we are focusing on researching and testing social innovation, in particular initiative led by the social economy that improve the social inclusion of different excluded vulnerable groups in rural areas. This webinar is organized as part of our Community of Practice, or COP, and most of you, or some of you, are probably already a member. But if you feel like, please join us. You should have a link to register to our Community of Practice in the chat. But today, this event is also organized in cooperation with ELIF, or European Local Innovation Forum, which is an EDOL initiative, and we'll get back to this in a minute. As a way of introduction, I would say, as we can all agree, rural areas across Europe face complex challenges, from demographic shifts to economic restructuring, a difficulty to access services and risk of isolation, etc. And amongst those people and communities at risks of exclusion are older people. So this morning, we want to ask ourselves, what are the challenges that older people face in rural areas? And we will pay special attention to the most excluded ones and to intersectional vulnerabilities. What are the scalable, community-led, social economy-led solutions that we have identified for older people in rural areas? And we will cover various aspects, from the digital divide to food insecurity, or to the role of informal carers. Maybe we can show the agenda of the day briefly. You'll see that we will have we will hear mostly from researchers and practitioners on the ground today. So we really encourage you to ask questions in the chat as we go, or share experiences. Before we start, I would like to give the floor to my colleague Yulen Leturiondo, who is going to tell us a little bit more about ELIF, who is our co-host for this webinar today. Yulen, the floor is yours.
Thank you so much. Thank you so much, Alexandra. I will try to share my screen. I hope you can see it. So good morning, everyone. And thank you so much to all of you for being here with us today. As Alexandra said, my name is Yulen Leturiondo, and I work here at EDOL, and I am also coordinator of ELIF. And today I would like to briefly explain to you what the European Local Innovation Forum is, which is a space where local actors across Europe can connect, exchange ideas, and collaborate to strengthen innovation in their communities. So in the next few minutes, I will explain you how we work and how we connect people. The European Local Innovation Forum, we also like to name it ELIF. It's an online space, in this case, for experts and organizations working at the local level, both in rural and urban areas across Europe and also beyond. I will explain that in figures a bit later. Its main objective is to facilitate the exchange of ideas, experiences, and practices that help strengthen innovation in local communities. What makes ELIF particularly valuable is that it connects different types of actors, stakeholders. In this case, we have practitioners, researchers, local organizations, policy actors, who are all working on different kinds of development, and territorial development, community-led innovation development. So the idea is really simple. We share experiences and we learn from each other. And this webinar, for example, it's a perfect example of this. So yeah, we can contribute to a more cohesive and resilient Europe in a sense. So ELIF is organized around 3 thematic communities till now, which focus on key areas related to local development. On one side, we have territorial development. Then one important area of ours is community-led social innovation, which focuses on how local actors collaborate to develop solutions to social challenges. Then the newest, we have environment and climate, promoting place-based approaches and co-creation to address environmental challenges. And finally, as I was saying, we have the territorial development that looks at how communities can build on their local assets and knowledge to respond in engaging challenges and opportunities. So these three thematic communities are the core, let's say, of ELIF, and allow members to engage in different kind of activities related to each of the thematic communities, and yeah, fosters discussions within these thematic communities. As I was saying, one of the really important areas of ELIF is the community-led social innovation, which I think for today's webinar is quite relevant. Because it focuses on local actors and how we can co-create solutions together to address social challenges, which I think it will be addressed in today's webinars. Within this community, we identify and showcase inspiring initiatives. And for example, in 2024, we launched our first call for inspiring projects, selecting 7 initiatives across Europe, including virtual, which you will hear more about it later today because it's one of the speakers. This project formed the foundation of the CLSI network, and we then launched it a second call at the end of 2025, and we closed it on the 1st of March of this year, and we have received more than 34 applications, and we are currently assessing them and select the initiatives. Yeah, and we will announce it soon. And well, I think that more or less you have an idea of what we can offer to you. There are different reasons that why your organization are joining ELIF. So first, allowed to connect. As I was saying, you will see that in my next slide that we have a huge network. Second, members benefit from regular updates, events, and exchanges, which provide opportunities to stay informed about new developments, new initiatives. And another important initiative that we started also last year, it's Expert Voices. Through this initiative, members of the forum can share their expertise and perspectives through short interviews that we carry out, highlighted innovative practices, lessons learned, challenges in their regions, in their local communities. And this initiative helps to give visibility to practitioners, but also to their expertise and what is happening really in the local communities. So till now we have launched around 14, 15 interviews. We launch more or less every month. We launch 2 new interviews, and we feature not only ELIF community experts, that is how we call them, but also ADL experts. So we have both sides, let's say, and creating this space for dialogue and exchange. And yeah, I was saying here, so here we have the figures and the activities. So as you can see, we operate through regular online meetings organized by thematic communities. In this case, this one today will lay in the community-led social innovation thematic community, and members are invited to participate in discussions. Today, the forum includes more than 2,240 members coming from all EU member states and for more than 60 countries of origin. So diversity, as you can see, is a key strength of this forum, and it brings different perspectives and experiences. The working language of this forum, if you want to join, which I think that my colleagues are sharing the links to facilitate this on the chat. The working language is English, so which allows participants from different contexts to engage and collaborate. And I think, yeah, with this, I will finish because I know that we have a very enriching webinar today, and I don't want to take more of your time. In the upcoming weeks, several activities are planned, really aligned with today's events. So I would like to link some of interesting discussions, such as Safe Habits Project, which is a project that explores safety, culture, and social innovation in different sectors, especially in farming. And these activities illustrate also how ELIF promotes this connection in research projects and practitioners and communities. So here you have two upcoming webinars that are one of the 24th of March on young farmers' perspective on the attractiveness of farming, which is the generational change in farming, and the 26th of March, we will be discussing about the understanding and strengthening of mental health services for Europe's farmers. So yeah, to conclude, ELIF, yes, aims to connect people, share knowledge, and strengthen innovation. That's our main core objectives and goals. And of course, if you are interested in learning more, we will be more than happy to connect with you. You have the links to join the forum. And also, if you have any kind of question, you can write to me personally or either to the ELIF inbox. So with that, thank you so much for your attention, and I will leave you to continue the webinar. Thank you.
Thank you. Thank you, Yulen, so much. Yes, please do look at the chat. You'll have all of the links and information to get to know ELIF a little bit better and join the community. Without further ado, I'd like to move on to the second phase of this webinar, our first panel, which we have entitled Understanding the Overlapping Challenges of Rural Aging. Quite an ambitious title. I'm very pleased to welcome Colin Yindle and Paul Milburn. I will first give you the floor, Colin. You are coming from Génération Mouvement, Union Régionale de Normandie, and later on we'll hear from Paul from the Cardiff University. Colin, you will give us a bit of an overview from your experience on the main challenges that older people face, in particular in rural France. Colin, the floor is yours. I think you're still muted. Yes, I think now is fine.
That is probably better. Good morning, everyone. I'm pleased to be here today and to talk about the challenges of aging in rural communities. I represent Age Platform Europe, where I'm a member of Age Council, and to represent as well Génération Mouvement, where I'm a member of the board of directors with the function of treasurer of our association. Just to put you clear, as I'm coming from France, but my origins are in South Wales. I was born in Cardiff, but I was educated in Bristol, England, and I'm a qualified chartered accountant. I went to Paris to work, and after 50 years in the Normandy countryside, I'm now able to talk about the challenges facing us as we grow older. I'd like to start by to say who we are in terms of Génération Mouvement. We have roughly 7,000 clubs of mainly retired people throughout France, and our membership totals nearly 500,000 people in France. And they all participate in the 7,000 clubs that are affiliated to our national federation. Our membership covers the whole of France, and that does include Corsica, Martinique, Guadeloupe, amongst others. Our territorial implantation is mainly rural, as our origins 50 years ago come from farmers who, when retired, they joined our clubs, or they even created our clubs at that time. So we do understand the difficulties that our members are facing today, and also their fears for the future. There are 5 main challenges that I would like to highlight, the first of which is territorial inequality, because each of the 9 regions of France uses its budget in different ways. In Normandy, a priority has been internet and mobile phone access, and although this has been slow to come, the overall coverage of the region is now very good. Those who can, those who wish, can get access to speed of optical fiber. Mobile coverage is generally 5G, but this is not the case everywhere. Certain regions, particularly in the Massif Central and other mountainous areas, they have to make do with relatively poor coverage. And this today creates difficulties as so much has to be done online. Another inequality concern from the territorial point of view is the availability of medical practitioners, whether that's from general doctors or to specialists. The southern half of France has in general more doctors than one finds in the north and west of the country. This brings me on to the second point I'd like to mention of the failing system of healthcare. Throughout the country, the healthcare system is under extreme stress. Doctors are overloaded with work. Any non-urgent appointment today can be between 1 to 6 months ahead. It's very difficult to find a dentist. Many people do not have specific doctors to whom they can rely on. And this does result in situations of stress for older people. And people then often use emergency services when it's not really justified. So this overloads in turn those emergency services. The third point that I'd like to make is access to public transport for people in the rural areas, because obviously mobility is very limited unless you can drive a car. This does mean that the new European rules on granting driving licenses to older people may impact the situation in the years to come, because some people may find themselves in a situation that they can't use their car. They therefore will have to rely on rural bus services, which in general today are very few and far between. And also, it may be a distance to get to a bus stop, and the bus maybe won't take you where you want to go. So that leaves the choice of a taxi and the excessive cost which is involved when you take a taxi in rural villages. Then the next point is social isolation, because as you well know, family members often leave the area and where they were brought up, and they go and find work outside, and they're therefore not available to give the help to aging parents, as was often the case in the past. And often when one of the members of a couple dies, the remaining spouse is confronted with a situation or a feeling anyway of isolation, which can lead obviously to depression. So simple tasks can become a chore, and rather than going to the local supermarket, at least you can order food to be delivered. But there again, that just accentuates the isolation. If you have no transport in this situation, then there are simple things in life like taking your refuse to the collection point becomes complicated. And this is where our clubs at Génération Mouvement can be of great help to ensure that the contact with other members in the clubs, it helps to alleviate isolation and to help people when they do need some help, and if they're unwell, and one can spend some time trying to get them, I would say, back on track. The first point concerns digital exclusion. And this is probably the most difficult problem for now and for the coming years, because the speed of progress in digital applications has been so rapid that many older people can't keep up with the changes. Internet has to be used more frequently. Appointments, particularly medical appointments, are often not taken by telephone now. They're only taken by online. So this complicates things considerably for those who are not able to easily use the internet. There are also the cases where bank facilities are online. There are local government offices if you need to obtain identity cards, driving license. Then all that is now done online. And so that does accentuate the problem, and even to the point that the taxation offices, everything happens through your account at the taxation office, and so it does limit greatly the possibilities for certain people, because if they can't access those people online, they have to go there in person, which then creates other problems. These difficulties even extend as far as getting cash, because banks, as they've disappeared from the countryside, have reduced their branches, and they've reduced the number of cash machines as well. And so it does become even complicated to get a bit of money in your pocket. So overall, I would say the situation that exists today probably can only get worse unless national government takes steps to provide for the aging population. And this does bring me on to my final point, which concerns policy making by central government. Because here in France, we did have a governmental plan which was due to be presented just recently on the 12th of February 26. And it was a plan which was known in France as the Plan Grand Âge. And this plan, unfortunately, has been put back sine die. And it does appear that successive governments are absolutely blind to the evolution in the demographic situation. By the year 2050, there'll be 23 million people in France over the age of 60. And of those, 2.8 million will be dependent people. This will then require a huge number of new jobs. It's estimated at 200,000 new jobs to look after these older people who will have different types of difficulties or handicaps. So it is an example of the urgent need of legislation and people who understand people who understand. I think everybody understands, but it is the wish and the wish to do it, which is important for the future. I would just like to say in conclusion that I do think that retired people have an important role to play now and in the future. And it is important to connect with all generations and to remain active during retirement. Our commitment at Génération Mouvement is to help people to do this through our clubs and also their numerous activities, whether they're intellectual activities, physical activities, or all kinds of other situations. Anyway, I hope that I've given you an outline of the difficulties that are presented today and for the future for people, certainly in France, and I imagine in rural areas in very many other European countries. But thank you very much for your attention.
Thank you so much, Colin. Really, thank you. A lot of what you said resonated with me. I am French and I used to work in the UK, and I worked with Age UK. So which I think has some commonalities with Génération Mouvement. We are monitoring the chat. Please continue to put questions, but I would like to give the floor now to Paul Milburn from Cardiff University. I think it's interesting to go straight away with your presentation, because you're going to give another example of a real, maybe less explored challenge faced by older people in rural areas. Paul, the floor is yours.
Okay, could somebody put my slides up then?
Yep. Yep.
There we go. Thank you. Well, many thanks for the invitation to speak to you today. It's a pleasure to be here. I guess for a long time I've worked on poverty issues in rural areas, and I've done that in the context of older people to a lesser extent. More recently, I've been working on food, and as part of that work on food, I've been doing a lot of work on cities, on food and poverty, but I've also been doing a little bit of work in rural areas, and also connecting with some previous work I'd done on older people and poverty. So what I want to talk to you about in the session this morning is the relationship between food insecurity, older people and rural places, which, moving on to the next slide, I think to start, I think it's useful just for me to explain what I mean by this term food insecurity, because it means different things to different people. I'm using a rather widespread definition of food insecurity within the presentation today from the FAO, in which they define a person to be food insecure when they lack regular access to enough safe and nutritious food for normal growth and development and an active and healthy life. Active and healthy life, I think, is an important phrase there. This may be due to the unavailability of food and or a lack of resources, predominantly financial resources, to obtain that food. I usually work around an idea of food poverty, but food poverty is a rather narrower take on this, which focuses solely on a lack of financial resources, i.e. a lack of income, causing food problems. And as I'll come on to talk about, if we just focus on the income dimensions of food problems, then that creates some fuzzy issues, some complicated issues when we think about older people and the food problems they're experiencing. So moving on to the next slide, I want to begin by thinking about what I call the missing geographies of food insecurity. I think we'll all agree that food has represented a prominent issue aspect of much of rural policy, much of rural research for many decades. But the way food has been addressed, it's been in relation to specific areas. I guess we're talking largely about food production and farming. And when it's been talked about in relation to the relationship between farming and rurality, very much seeing farming as a positive contributor to food, as a positive contributor to rural economy, to rural society, to rural cultures and identities. Much less has been talked about what we might see as the darker sides of food in rural places. So in relation to farming, there's been some limited discussion about the plight of smaller farmers within the food system, about the marginalised position of migrant workers within agriculture, but very little has been talked about in terms of the difficulties faced by people without cars, people low incomes, people in smaller, remoter places, in terms of their ability to access affordable, healthy and fresh foodstuffs. Even less has been talked about in relation to food poverty and food insecurity, which is why I want to focus on this issue of food insecurity amongst older people in rural areas. So moving on to the next slide and thinking about some of the reasons why there's been this neglect of the rural dimensions of food insecurity. I think we can see a number of reasons here. First of all, we can talk about the way in which dominant narratives of rurality and food present rural places in particular ways, see rural places as very much associated with, surrounded by food abundance rather than food scarcity. So there's sort of a contradiction there. How can people be without food when they're surrounded by it within their everyday lives? Secondly, when we think about food insecurity in an urban context, that there is elements of spatial concentrations. You see food insecurity, or people experiencing food insecurity in particular neighborhoods. In rural areas, as we all know, it's a little bit different to that. People experiencing problems are scattered across smaller and remoter settlements. When we look at official statistics on food insecurity, particularly in the UK, we find these are largely at a national level, which makes it near impossible to look at food insecurity levels in relation to different types of place. When we think about where emergency food providers, food aid charities and so on are based, they're largely absent in rural areas, and when they are present within rural areas, they tend to be in the larger towns. Now, given that much of the research on food insecurity has focused on food aid and food aid organisations and people using those organisations, you can see why the rural dimensions of food insecurity have been a little bit neglected. And when we bring older people into this picture, if a lot of the research on food insecurity is focused on food banks and food aid organisations, when we look at statistics relating to older people, and this is a particular one at the bottom of the screen here from the Trussell Trust, which is the largest network of food banks in the UK, you can see that older people don't really feature in terms of being a user of food banks. So when we pull this together, we've got a neglect of the rural dimensions of food insecurity. We bring older people into that. We've got a near invisibility of older people's food insecurity in rural places. So moving on to the next slide and thinking about the relationship between older people and food insecurity, it's not a straightforward one. And as I said before, the relationship between food insecurity and income is a little bit looser when we think about older people. So yes, older people on the lowest incomes are more likely to be experiencing food insecurity, but that relationship between income and food insecurity is a little bit different, largely because older people, retired older people, are on incomes that do not fluctuate as they do with working age people who maybe go from one job to another or become unemployment and then find other jobs and so on. It's a much smoother path in relation to the income that they will receive in the future. Now, in one sense, that gives older people financial stability. But in another sense, if hypothetically at the moment we were going through a cost of living crisis, where food prices have escalated significantly over the last few years, where the price of fuel has gone up quite a lot, then you can see how that creates sets of difficulties for older people reliant on fixed incomes. Now, I said before, we need to move beyond income when we think about food insecurity in older people. There are issues of mobility, and Colin has touched on those in his presentation. Getting to food shops beyond the locality when you can't drive or don't have a car, and public transport is rather limited, creates sets of difficulties. And there are really important issues, as Colin also said, about loneliness and social isolation amongst older people. It's been shown that older people living alone tend to take in less food, but a lot of the literature talks about the ways in which we need to see food, as one person said, as a proxy for social connection, meals understood as social events. The importance of sociality and food for older people is a really significant thing. Moving on to the next slide, which is about what we might call rural foodscapes. What do I mean by that? Well, so the rural food environment. And people have said that there are some distinctive elements of the rural food environment. First of all, that it's more difficult to shop around for affordable, for cheaper food, for fresh food, for healthy food. So there's a restriction in terms of the food retail opportunities that you have. Back to this idea of food and sociality, there are much fewer opportunities to engage in what we might call social eating in rural contexts. Not as many cafes or restaurants where you can meet up with friends and family to eat out. And as I said previously, a third point, a very much underdeveloped food support infrastructure in many rural areas. So moving on to the next slide, it also follows that it's a little bit more difficult to address issues of food security, insecurity in rural places. First of all, as has been shown with a lot of research and policy reports on rural poverty, there are very much stronger denials of poverty and what follows through food insecurity in rural areas, denying it within your own lives, but also denying it within the lives of other people living in your rural community. There's also a much increased reliance on informal systems of food support, and I think we're probably all aware of some of those things. Less reliant on formal welfare provision, more on informal welfare provision. There is very much an antagonistic attitude towards food aid organisations, food aid projects in rural areas. That comes out of the research literature. And there are also problems in terms of the food aid model and how it can work in rural areas. The food aid model or food aid organisations, when they're present in rural areas, as I said, tend to be in the larger towns, which creates some access issues. But they're very much reliant on people coming to them rather than the projects going to the people and to different places. Now, different models of rural food support are around being experimented with, particularly in the UK context, which I'm talking about, moving from a fixed base to a mobile service, moving away from donated food to providing more affordable food for people, and to develop more community-based approaches to food support. And this takes me on to the next slide, which just introduces the project that I'm just going to talk about for my remaining 3 or 4 minutes. What we've been doing is analysing what we've found in terms of some national food insecurity data, which allows us to look at that by age and geography, to break it down by rural and urban places. But we've also been doing some ethnographic work with older people, talking to them about their relationship with food and food insecurity in the context of one of these alternative providers, a community hub in a particular rural area. And I've been doing this work with those 2 people who are mentioned on the bottom. I'm now going to move on to quite a complicated slide, which is a table with lots of information in it, and I'm going to try and take you through this. This is from the national survey data that we've been using. It uses a definition of food insecurity that comes from the US Department of Agriculture, based on 10 indicators. And if we just focus on the older groups, the 65 to 74, the 75 plus, and if we focus on that right-hand column, you can see that even though older people are the age group that has the lowest income within society, something different is happening here, that their level of food insecurity is the lowest across all of those age groups. And that's consistent across all of those years, all of those columns you can see there. But what has also been happening, if you just focus on those 2 age groups, the 65 to 74, the 75 plus, you can see there's been quite a significant increase in the incidence of food insecurity amongst older people. And that increase has been the largest across all of those age groups. And if we move down the slide to the urban and the rural area part of the slide, you can see that there's a lower proportion of people living in rural areas that are reporting food insecurity than there is in urban areas. Now, what we can also do with this data, if we move to the next slide, is look at the use of food aid and food clubs amongst people of different ages and in urban and rural areas. And again, the same point coming out, that when we look at the older age groups, we can see that they are least likely to be making use of a food bank or another emergency food provider. And if we look at the difference between urban and rural, given what I've said about food banks and food aid organisations not being that present in rural areas, we can see a lower incidence there. But something interesting happens when we move across the slide to the food club side of it. These are the more sort of community-based, more affordable food clubs that I was talking about before. We can see that there's a larger proportion of older people making use of those, and a little bit more usage being made in rural areas as we move from the food bank to the food club. I just want to finish my presentation by just talking about some of the initial findings from our work with the Food Club. So if we move to the next slide, what we've been doing is been working with an organisation which we call Cherry Fields, which has got a base plus some satellite sites. So it's a hub and spoke model. It's very much about providing affordable food than free donated food, and it's about providing also community meals for people. When we go into this site, we see that the main users are older people, the main volunteers are older people. But what I was talking about before, when we start to talk to people, older people using this site about their food problems, they talk about food problems, but very much deny that these are related to poverty or any sense of food insecurity. And when we move to the final slide of the presentation, what we see is the approach taken by this project to very much focus on the community, the social dimensions of the project, mean that it's very much valued, respected by the older people using it. They see it as a space of socialization, a place to go and meet people with food rather than a place to go to food per se. The projects and the events are very much focused on community, familiar community spaces, schools and churches and village halls, which makes it easier for people to use. When people go to these places, older people go to these places, they're sharing things with other people. They're sharing conversation, but they're sharing gifts and recipes and advice about food. And these two things together, the familiar community spaces and the sharing spaces, mean that a lot of the stigmatic aspects of making use of food aid just goes out of the window, and people are going to these places to meet other people, to socialize with a food dimension to them. They also provide a very good routine for people to address issues of loneliness. And because older people are able to buy food at much cheaper prices, they see this as a really important value, shared value of their own thriftiness with what they can get from the community project, that they like purchasing things at bargain rates. And so going to these sort of places allows them to practice that behavior that they've practiced for many years. So for all of these reasons, this type of project seems to be engaging much more positively with older people and their food issues and food insecurity more specifically. Thank you.
Thank you, Paul, so much. I like that you have actually described how we can shift a little bit the mindset on providing food. While our participants put questions in the chat, I will ask you, Paul, and Colin, a few questions as well. Maybe, Paul, because I'm conscious you have to leave soonish. Maybe if you had to mention one aspect that surprised you the most so far in your research, what would it be, first? And second, so far, what if you were asked by a local municipality what they can do on the short term with small resources to help tackle food insecurity, what would you say? You're still muted. You're still muted.
I was going to say, two very good questions was what I was saying when I was muted. In terms of what surprised me, well, it does and it doesn't, would be that those statistical incidences of food insecurity, that older people, typically on the lowest incomes, are coming out as the least food insecure. But when we think about how that food insecurity measure is calculated, it's not an objective measure. It doesn't measure how many nutrients are going into an older person's body or a person's body. It talks about people's experiences of food and their behaviors towards food. So whether they buy certain foods or they adjust their lives in relation to certain things. So it's very much connects to some of the behavioral stuff that has been talked about in social gerontology and rural gerontology, the ways older people I guess respond to certain situations and expect certain things or don't expect other things. In terms of what my advice would be to a rural community wanting to do some things, I'm also doing some other work at the moment in rural Wales, and we're very much focusing on the relationship between food, community, and well-being, and the ways in which, if you go into dealing with food insecurity through a community framework, through a community-led approach, you bring people together, and then you add food to that bringing together, or you use food as something that is able to bring people together quite neatly, and then you start talking about problems, and food problems then emerge, and it's a much more subtle, it's a much more sensitive, but it seems to be a much more successful approach. And not only does it address issues of food insecurity, but it also addresses issues of what we might call community resilience. It feeds people literally doing this, but it also feeds communities in terms of their ability to withstand various shocks that they're facing at the moment.
Thank you, Paul, so much. Colin, I see you taking a lot of notes, so I wondered if you wanted to react and give your perspective on what Paul was talking about, actually, about food insecurity.
But yes, indeed, I would, because it's very interesting that our approach in our rural clubs is not one of food insecurity as such, but nevertheless, everything that Paul has said about bringing people together and using the food element as being an essential element which will push people to participate in events is really important. And we find it, although, as I'm saying, we're not approaching it from a food insecurity angle, but nevertheless, we're approaching it from a social isolation point of view. But in fact, the results appear to me to be very much the same, because the people are, first of all, very ready and willing to participate in something when you say, and we're going to finish with a meal. And as long as the meal is correctly priced, and it's not some sort of stupid price, but it's an affordable meal, then one sees that people are very much prepared to participate. And that is the whole essence of moving away from the social isolation that people may be in, some more than others, obviously, and enables them, as Paul was saying, to get together, to start to talk and to open up and discuss things which otherwise they would not have the opportunity to do. So that strikes me as being really a very, very important factor. Although, and it's interesting because we don't approach it from the food insecurity, but listening to what Paul has said, I do understand and see that we do have members who are selective. In other words, they would come to an event where the meal or the whatever's proposed in the way of a little snack or something, if it's reasonable, they will participate. If it's too expensive, well, they won't say so, but they'll perhaps not do it or choose another activity. So I think really there, yes, we're absolutely, we've got this combination between the social side of alleviating the isolation of older people, together with, yes, maybe there is certainly an element of food, well, the element of food is very important in all of that, yeah.
Thank you so much. And I have a question in the chat for you, Colin, and actually I invite you both to look at the chat because there's been a lot of discussion going on. I believe Edith was asking us, how do you see the relationship between aging populations and newer migrant community members? Have you seen ways that we could connect these communities in rural areas?
Yeah, that's a very good question, because the migrant population at the moment is not that present in the rural areas. Migrant population, I believe, is mainly situated in urban areas. So the bigger towns have the problem to cope with, which it is not when it gets to rural areas. It's no longer a problem, because if somebody comes into an area and they wish to join a club and that they're going to participate in the activities, then they're accepted, because there's no, people aren't going to differentiate between someone who comes from elsewhere as to somebody who comes from local person. But I would say that in the urban areas, the integration exists quite definitely, because people join for certain activities and that sort of thing. But in rural areas, I was just thinking, but I don't think I know of a huge number of examples where there are migrant workers who have integrated local clubs. So I can't really say. But I imagine because it works in the more urban areas, I'm certain there would be the same acceptance in rural areas, although maybe people are more reticent to come forward. I was just thinking about it is much easier, for example, when you're talking about migrant people. It's obviously much easier for somebody, particularly in France, who comes from the territories that are outside of France, whether that's in the West Indies or whether it's in the Ile of the Réunion or so on. It's much easier for those people to integrate because they speak French and it's easily done. The language barrier is often perhaps a difficulty, which takes time to overcome.
Thank you, Colin. I don't know, Paul, if you also wanted to react on this aspect.
Yeah. Mm-hmm. Well, I'd probably just ask the question: what do you mean by migrants? I mean, there are different types of migrants. There's migrants that are in the news at the moment, but certainly in the UK, there's been migrants from more affluent middle class backgrounds moving into rural areas for many decades now. But if I take sort of migrants in terms of refugees, asylum seekers, that group, first of all, what we're seeing in some of our projects is how food is able to bring different groups together and can just get rid of a lot of barriers. Food is a universal. And using food, and particularly food being brought from, or food that you're used to in your home country, bringing that to your new communities has been seen as a wonderful way of integrating refugees and migrants and asylum seekers into the area. But another aspect of this is our work in rural Wales, where the Welsh language is still strong in the western and the northern parts of rural Wales. The ways in which migrants coming in are working in some of these projects and change the language of those projects from Welsh to English, and we're seeing that when that happens, there's quite a significant group of older Welsh-speaking people who feel a little bit marginalised by that process. So language becomes quite an important thing there in relation to, I guess, new groups coming in versus more established groups within the Welsh countryside.
Of course. Thank you, Paul. Yes, thank you, both of you. Actually, we'll be hearing shortly, and Claire Dalton just mentioned it in the chat, we'll be hearing shortly about Third Age Ireland, which tackles the question of migrant and refugee integration in rural areas. We have 4 minutes left. Maybe I wanted to ask you, Colin, very briefly, if you could talk to us a little bit about maybe the two higher advocacy priorities that are pushed forward by Age Platform Europe.
Yes, well, there are many priorities, but I think that particularly today, because Europe has become somewhat disorganized compared to what it was a few years ago, and there's very much there's a certain amount of dissension, and so different countries are doing different things rather more perhaps than they were doing previously, where they tended to all move together, and it quite clearly now that is more difficult. However, the priorities for Age Europe remains to connect with the whole European community and to try and to put forward the general advocacy of a more integrated approach wherever you might be in Europe. And I think that is the object of having a certain number of members from all over Europe who work in different areas, but at the same time, it's all for older people, so that what we hear, we understand, because it's coming from people who have the same sort of difficulties wherever they are, whether they're in Sweden or whether they're in Spain or Portugal or Italy. And so the idea of trying to get a bit more cohesion so that one can put to the various governments, and we try and push that here in France, to say, well, look, we keep telling them that, you're not doing what you should be doing. What you should be doing today is thinking about the situation of older people, and how are we going to deal with people who will gradually become dependent, and there'll be far more of them. And if today the system is creaking and doesn't really hardly manages, well, tomorrow it'll be much more difficult. So our objective is to try and get government to realize and to act on this cohesion. But what we're saying is, as well, as older people, we mustn't sit back and expect it to happen. We must participate in that process to help make it happen, and to be an actor on the ground, and to get to make some real progress. Because at the moment we're very much we're very unhappy about the fact that a law that has been in preparation for the last 12 months, that because the minister decided to go and do something else, that they just left it in a drawer and said, oh, well, we'll talk about something else. We won't talk about that. Well, that is totally unacceptable in view of the size of the problem.
Absolutely. Well, thank you both so much. I really encourage you to look at the chat, because there are some interesting insights there. I think one or two questions, if you have the time to tackle them, please do in the chat. I'm conscious of time. So a big thank you to you both, Colin and Paul, for taking part in this webinar today.
Well, thank you.
Thank you so much. So we are now going to move on to our second panel. Please do continue to share your experiences, your questions in the chat. We are keeping track of them. Our second panel is looking at models to rebuild the social fabric, to fight isolation, and to fight the digital divide. So I'm pleased to welcome Mai Timi, Mariana Sunsao, and Claire Dalton. We will first hear from you, Mai, You are from Estonia. You are representing Voru, and you are also a pilot project within the SERIGO project that is hosting us today. And your organization focuses on men at risk of isolation after retirement in rural areas. May, the floor is yours.
Thank you very much. I will now start to share the screen as well. Okay, so you see the screen.
Yes, thanks.
Excellent. So thank you very much. And I must say that the first panel very nicely warmed up my presentation as well. So a lot of common problems and a lot of common challenges I found out from the previous presentation. So thank you very much for that. So now I will move on and represent you a little bit what we have been doing through the SERIGO project as a pilot partner, what kind of activities and why we have been carried out this far in Estonia. And just a little bit to put you on the map, I must say that we are a small area in Estonia. Estonia is small anyway, but we are situated in the south of Estonia, very close to the Russian and Latvian border. I must say about 30-40 kilometers to both of those countries. And our area is mainly the rural area, of course, and inhabitants about 30,000 inhabitants. So this maybe gives you a little bit of the context of what kind of areas we are working with. So through the SERIGO project, we decided to take a focus on men and older men in our area. And we named the problem through the loneliness, because in practice and also the surveys support this, that older men, when they move from the labor market to the pensioning age, usually the activity of them is getting more lower than women. We see the lack of agency, and also sometimes we don't know what the needs of those target groups are. And as you see from the slide, yes, we see due to that, we see the really high risk of social isolation, especially men, because they are not so willing to participate, and maybe there are not so many options to participate in a community life, to have these meaningful experiences in participation. And they are less engaged, as we see, because we have a lot of activities where women are active. And of course, when we focus on the life expectancy, then especially in Võru County, the man life expectancy is shorter than compared to the national level of this number. And of course, if we compare the European level, then it's quite less. So what we have been doing during this piloting period this far, I must say that we are in the middle, so we are still continuing with those actions. And when you hear those actions and you see and you think about those, then I would say that maybe what we have been doing is not very innovative, but the most valuable is the thing how we have been doing those actions. So first of all, of course, our project team is mainly consisting of women. And it's not very fair to organize events to men as a woman without knowing what the real needs are. So first of all, we started with one of the methods where we tried to gather the real opinions and the real insight from the target group, from men, from older men. So we set up a method, which is a discussion method that we have developed in Estonia, which is named as a Journey of Opinions. This method is used to get a really diverse insight from different target groups, and not only organizing big events where you want to organize discussions and so to maybe gather people together in one big room and then have a discussions, but to get some insight from smaller groups, maybe friends who are visiting sauna or friends who are discussing the world issues in a cafe. And this method is specially designed for that kind of information gathering. And we have been writing about this method in our SERIGO project as well, but the main focus there is that first of all, we needed to get the discussion leaders. So we made a call for that, and we really got some discussion leaders. We trained them a little bit, and then they organized themselves those discussions. Of course, we set up topics which were connected to the men's and their lower activity in a community and so on. And then we gathered the results. And I must say that we got a little bit less insight from the discussions than we expected. But what was very valuable from that process was that we got the discussion leaders. We got very motivated discussion leaders with whom we worked further, and we are still working with them. From those discussions leaders, we have been forming an initiative group, which is now organizing those piloting actions that we are carrying out through this project. So together with this initiative group, we analyzed the results of this journey of opinions. We looked at the results, we discussed it, we even dig more deeper to really understand what is behind those results and those thoughts. And we build a common understanding of what we actually need to do with those older men then. We co-designed those pilot actions that we have been now doing together with this initiative group. And this group has 4 very active men who are from this target groups, which is 50+ men who are getting closer to the pensioning age. And there are 3 women, which are our project team. So out of this initiative group, we have been organizing the activities that you see on the slide. We have had inspirational evenings for men in our county. We have had 3 events. We had different guests who have been talking very inspirationally, different topics for about men's health, for example, and also about adventures, maybe some hiking and that kind of things, which really are very kind of famous people in Estonia, famous men in Estonia. And in those events, our initiative group members have been leading those evenings, so that they are really connected with those. At the first, we weren't very sure how many men we get in our room, but we were very happy because we have had 50 to 70 participants. The second action that we have been piloting is the kind of a men's group, 55+ age. This is a kind of group working method that we got inspiration from Finland. And in Finland, they have been doing this method for divorced men, but we adapted the topic to the older men. And so the group consists of 10 very regular meetings with very concrete group, and our really good and great men who are guiding this group actions and the discussions. They are leading those discussions over there. So the main target is that the men who come to this group, they don't have to have a concrete problem, but this is the place and the time where they can maybe dig more into the aging issues and maybe to more set up the purposes or some goals for their following age, and maybe how to maybe cope better with moving from the the labor market to the pensioning age. And the last but not least is that 2 men from our initiative group, they didn't have very active role so far. So they always thought that what they could do, what would be their action, their kind of thing that they really feel good. So we designed a kind of a new, a third kind of action, which was a fireside talks. And these are the talks where people are gathering together, the men are gathering together, and maybe about 10 or 12 men. We have had those talks 2 times for now. And this is the place where they are not so much guided, the discussions, but they come together and they just talk about life and decide what would be the next topic when they meet up again. So how we have been really doing that? We really co-create. because the group of women don't know what the older men need. So we are seriously co-creating, we are discussing the issues, and we are designing all the piloting actions together with this initiative group. And we really pilot. We never had no idea how the other men are really engaging those actions. But we are really happy that this far the events have gone really good. We really learn to know each other. We have really found out that those men from our initiative group, they are really good guiding and discussing and doing that kind of things, but they are not ready to do some project bureaucracy or that kind of things. So this is the place where we really share the responsibilities. And what is really valuable is that the men in our initiative groups, they are also really supporting each other in those actions, giving advice. For example, from the one of the men's group leader is giving advice to the leaders of these fireside talks, leading men. And we are really doing this with the target group. So they men themselves are leading those actions with the support of the project side. And we really put some informal sides also into this planning phase. For example, we have had meetings in each other's homes. Those men who are ready to maybe invite people to come to visit them, they are really open-minded, and we have been organizing the events in their homes if they are ready for that. Some of them have some bigger rooms, for example, for some visitors. And we also have some common lunches and some visits to cultural events. If we have something to celebrate, for example, we have reached to some kind of point where we have something to celebrate, then we really try to put that in the focus. So quite in the end, I would like to remark what are the next steps we are taking now is that we would like to widen the initiative group. We don't have this health and sport issue in our initiative group at the moment. So this is something we would like to move forward and to widen the group. We will continue organizing these events to be sure that those actions really work. And what is really important that we would like to raise the topic more into the middle of the attention of other organizations, village organizations and communities to maybe encourage them to work also more directed with this target group in their following actions. So these are our plans for the next piloting action period. And this is where I would like to thank you in the end. And also we have our separate webpage, which is written down here. Unfortunately, it's in Estonian, but if you are ready to translate it a little bit, then you can, of course, visit this.
Thank you
very much.
Thank you so much, May. Conscious of time, we will take questions after the end of the panel. So do feel free to put them in the chat as we go along, and my colleagues and I are collecting them. So I would like to give now the floor to you, Mariana. Mariana Assunçãos, I hope I'm pronouncing this correctly. You are from Virtual in Portugal. Actually, Virtual was selected in our Inspiring Practices, Inspiring Project with our ELIF 2024 call for inspiring practices of community-led social innovation. You are going to talk to us about how Virtual endeavors to bridge the digital divide and provide digital and health literacy to elderly residents. Yes, Mariana, the floor is yours.
So sorry. Can you hear me already?
We can hear you, and we could see your screen, and we don't see it now.
Oh, okay. Sorry. I'm trying to share again. Okay. So I think that's okay now.
Yep.
Okay.
Yes.
So good morning, everyone. First of all, thank you for the invitation for this interesting discussion of today. It's a pleasure to be here today. My name is Mariana Assunção, and I represent Avelo. And today I will share the experience, like Alexandra mentioned, of Virtual, a community-led initiative developed by Avelo to promote active and inclusive aging in rural areas. But to better understand the context of our work, let me briefly introduce our organization and the territory where we operate. ADEL is a local action group based in Cantanhede, operating across 6 rural municipalities in central Portugal. We operate in a predominantly rural territory characterized by low population density and dispersed villages. Approximately 29% of the population is aged 65 and over, and many other residents live in remote areas with limited public transport and increasing distance from essential services. At the same time, essential services are becoming increasingly digital. This creates multiple challenges, but for today's discussion, I will focus on the 2 key challenges of the discussion: social isolation and the digital divide. In our dispersed rural villages, loneliness is often silent. Limited mobility and weak transport systems create distance from services and reduce participation in community life. Isolation in rural areas is not always visible, but is deeply felt. Furthermore, many older residents have little or no experience with digital tools. Technology is often perceived as complex or intimidating. At the same time, health appointments, public services, and even communication with family were increasingly moving online. These 2 challenges reinforce each other. When someone is socially isolated, they are less exposed to digital learning opportunities. And when someone is digital excluded, their social isolation increases. So the question became, how can we fight social isolation and reduce the digital divide at the same time in a rural low-density territory? And this is where Virtual comes in. Virtual was developed by ADEL in response to these challenges. We launched the project in 2019, and since then it has evolved to a territorial ecosystem for active and inclusive aging across the municipalities involved. The name Virtual reflects our approach. Virtual highlights the role of technology, and role reflects inclusion, ensuring that all people aged 65 and over in our rural communities can participate. As you can see in the logo, the circular lines represent the municipalities in our territory. Together, they symbolize connection between people, between places, and between technology and community. And to achieve this, we organize our responses through 3 key enabling factors that sustain our model. Our first enabling factor is to build a territorial ecosystem. From the beginning, we understood that isolated interventions would not be enough. So we brought together municipalities, universities, research partners, technology startups, and civil society organizations. As you can see in the photos on the slide, these are some of our regular working meetings with partners, both in person and online. This cooperation allowed us to combine local knowledge with innovation capacity and scientific validation. We built cooperation before activities, and that made all the difference. But we also need practical tools to reconnect people, and that brings me to our second enabling factor. It is to promote access to technology as a tool for inclusion and connection. We delivered decentralized sessions across the territory. We traveled to different municipalities and even isolated villages, bringing the equipment with us. This ensured access, but also create moments for social interaction. As you can see in the videos, we use tools such as virtual reality headsets, immersive experience that simulate cognition and curiosity, interactive hazard games, a playful digital platform of augmented reality that combines movement with cognitive challenges, physiosensing, here, a motion-based technology platform that supports balance and coordination, tablets to build digital confidence and practical skills, and also educational robotic tools, here, to stimulate creativity, logical thinking, and engagement. We also delivered practical digital literacy workshops, helping other people use smartphones, communicate with family, accessing public services, and manage health information. These activities are not just for entertainment, they combine physical activation, cognitive stimulation, and social interaction, while helping other people build digital confidence in a safe and supportive environment. But active and inclusive aging is not only about the access to tools, it is also about voice, participation, and agency, and that brings me to our third enabling factor. That is community-led participation. We realize that active aging cannot simply be deliverable. It must be co-created. So we create sessions where other participants actively help design the activities and identify local challenges. Alongside these sessions, we established an intermunicipal senior assembly, a space for dialogue and civic participation, where elderly representatives from the municipalities reflect on how their municipalities can become more age-friendly and inclusive. Meetings take place depending on local agendas and the project timelines. The format is flexible, but commitment to participation is continuous. We also organize the virtual championship, now in its third edition. Each year, a different municipality hosts the event, welcoming more than 250 other participants in a healthy digital competition. And through intermunicipal nature routes and heritage visits, older people visit other municipalities, discover local traditions, exchange experiences, and reconnect with shared memories and identities. These are different activities, but they all serve the same purpose. Older people are no longer passive recipients of the services, they are also co-creators of the program. And when people feel ownership, the participation increases and also isolation decreases. So what has been the impact of this approach briefly? Since 2019, more than 1,600 older residents have participated. Around 98% report being fully certified. They also report improvements in digital and health literacy, as well as increased social participation. But beyond the numbers, something even more important happened. People kept coming back. Friendships were built across the municipalities, confidence in digital tools increased, and participants report feeling more connected and more valued. Because of this, Virtual has received several national and European recognitions. In 2024, it was also recognized as an inspiring practice by the European Local Innovation Forum, which is particularly meaningful in the context of today's webinar. And this ecosystem approach is already evolving, generating new initiatives. One example is Terra Game. In English, is something like Earth Game. It's a new project that we are developing together with Shine to Europe, another Portuguese organization. It became possible because Virtual created a strong rural ecosystem. After years of building trust, improving digital literacy, and promoting this intermunicipal cooperation, the conditions were there for new ideas to emerge. Terra Game is a new initiative focused on circular economy education for older adults. It was selected as a winning sub-project under the European Futural Open Call program, and it combines two components, an Android educational game and a toolkit of practical community activities. And once again, it is being co-created with the same rural communities involved in Virtual. So this is not a separate project, this is the ecosystem evolving. So what are the key ideas to finish I would like you to take from this presentation? First, rural areas can innovate. Second, technology works best when it reinforces human relationships. Third, active and inclusive aging requires ecosystem that promote cooperation across territories. And finally, older people must be part of the solution. And that's it. Thank you very much.
Thank you so much, Mariana. And I think you said something that resonates with what Colin said about older people being part of the solution. We're now going to give the floor to you, Claire Dalton. You are part of Third Age Ireland. You are also a case study. Third Age Ireland is a case study within the SERIGO project, and we are very happy to welcome you today to talk about a volunteer-driven model for community engagement. Claire, the floor is yours.
Thank you very much. Hopefully you can see my screen.
Yes, we can.
So good morning, everyone, and thank you for the opportunity to speak today. My name is Claire Dalton, and I work with Third Age Ireland, which is a national organisation here in Ireland focused on ageing, participation and social inclusion. Across Europe, and this is shifting, but the narrative often around the ageing populations is often spoken about in terms of pressure. So pressure on our health systems, pressure on services, pressure on communities. But in our work in Third Age, we are focused, I suppose, this morning on something very different. We see older people here teaching, listening, welcoming newcomers, supporting neighbours, and really strengthening urban and rural communities. And in other words, in our organisation, older people are not simply beneficiaries of our social projects, but they're key contributors to how these projects work in practice every day. So this morning, I'd like to share how our community-based projects led by older volunteers can help rebuild the social fabric of communities, reduce the isolation that we're seeing, and strengthen overall participation, particularly in rural areas in Ireland where distance, ageing populations, and as others have mentioned, the digital divide can really intensify the isolation that people are feeling. One of the defining features, I suppose, of our organisation in Third Age is we don't see older people simply as recipients of services. Instead, our projects all focus on mobilising older people as really active participants in our society and providing plenty of opportunities to do that through our projects. Across our programmes, we work with thousands of volunteers, many of whom are retired but very eager to remain engaged in their communities. And it goes without saying that they bring their time, their life experience and a local knowledge that really strengthen community life. In Ireland, there is increasingly a growing sense in communities that we can't sort of rely on a someone should do something about that approach to social challenges. And here in Ireland, we see people really stepping forward to act, to try and resolve some of the issues and challenges that they're seeing in their own communities.
Claire,
and older people.
Sorry to interrupt. I was just wondering if you're changing slides or is it normal that you're not?
Yeah, I'll change now. 1 second. I have many slides.
Oh, no, as long as it's all fine, because we were wondering. Thank you so much.
Perfect.
Sorry.
No worries. So we find in Third Age, when older people are given these meaningful opportunities to contribute, the benefits really extend far beyond the projects themselves. And many of our projects are not simply, older people are not simply involved in the impact, they are the impact. We see this community participation very clearly through our local project in a rural village in County Meath, which is also home to our national headquarters. Third Age Local acts as a community hub where older people come together for regular activities, including things like exercise classes, social afternoons, trips and projects. And every week the centre hosts activities such as yoga, line dancing, things like a knitting group that recently produced hats for premature babies in local hospitals and warm clothing for people experiencing homelessness. These activities are simple on a local level, but they play a really important role in helping people remain socially connected in rural communities like Summerhill and active and visible within that community. They also show how older people are not simply participating in that community life, they are actively shaping it. A second kind of key ingredient as well in our work is that even though all of our projects operate nationally or on a larger regional level, they remain deeply focused on the individual. Many of the interventions that our projects provide are simple, so weekly conversation, a phone call or a listening service. But we find that these small human interactions can have a significant impact on well-being and connection. And in communities where services are distant, overstretched, these interactions often become the foundation of everyday social support. And with all of that in mind, our 3 major projects, which I'm going to introduce in a second, are designed to be flexible, adaptive, and really responsive and informed by local needs. This approach in Ireland works particularly well in rural areas. As we know, rural communities often face challenges such as distance, limited services, and of course, what comes with that is increased risk of isolation. But our rural communities in Ireland also have incredibly strong traditions of volunteering, community participation, and simply getting things done. Often that comes from out of necessity. So our role in Third Age, we view, is to provide a framework often, but the projects themselves are shaped and led out by those local communities. Across our work, we see 3 main ways that this approach helps strengthen communities: through integration, through support for aging at home, and through connection for people experiencing loneliness. And I'd like to briefly illustrate this through 3 of the projects that we deliver. The first is Fáilte Isteach. Fáilte Isteach means welcome in Irish, but it is an English conversational project. So it's a volunteer-led conversational English project which supports migrants and refugees learning everyday English in community settings. And since 2008, we have been supporting refugees and migrants integrate into both rural and urban communities through informal language projects. The programme now operates in over 260 locations across Ireland, and many of them are in rural towns and villages that have experienced very high numbers of migration and refugees arriving in recent years and over the last 20 years for many different reasons. The classes are run primarily by trained older volunteers who meet learners every single week for practical, everyday language, informal conversation. So they are tutoring, but they are focused on the language that people need most, which is to communicate and engage within their new communities. In 2025 alone, the project supported over 27,000 learner participations. Many of these learners living in smaller towns and rural communities where opportunities to practice English and meet local people are limited. So while the project focuses on language learning, its impact is often as much social as it is linguistic. And in smaller communities, these classes frequently become one of the very first places where newcomers can meet local and long-standing residents. In places where social networks can be quite established already, and we see that a lot in our rural communities in Ireland, a weekly conversation group in a local library, a parish hall, or a community centre can become one of the few regular spaces where people from different backgrounds meet. Volunteers and learners sit together, they share their stories, they practice language without pressure, and most importantly, they build real, authentic relationships. Through these conversations, people learn about everyday life in Ireland, but they also learn about each other's culture and experiences. For many of our learners that come through Fáilte Isteach, it's their first real experience of a sense of belonging in their new community. But the impact we see is not only for learners. Volunteers often describe how the experience broadens their own perspectives and creates connection that might otherwise have never happened. And I suppose in a time when migration and integration are often discussed in more abstract or political terms, these small regular conversations really create something more tangible, understanding, familiarity and trust, which is especially important in our rural communities. So in this way, our older volunteers in rural areas don't simply, I suppose, support language learning. They really become agents of integration and social cohesion within their own community. So they have huge ownership over that happening. The second project that we run that I'm going to talk about this morning is called Senior Line. And this is Ireland's national confidential listening service for older people. The service has been supporting older people for over 25 years now, and last year received more than 33,000 calls, an increase of over almost 18% on the previous year. Many of our callers live in rural areas and experience loneliness and, again, limited opportunities for regular social contact. For some callers, particularly those who may not be confident using digital technology, the phone in Ireland remains one of the most accessible ways to reach support. But a key strength of Senior Line is that it is peer-to-peer. So it is older volunteers supporting those that may feel more vulnerable in terms of their peers, with empathy, encouragement, and practical advice where needed. Many of our calls might be simple conversations, just offering company to people who may have few others to speak to, while others involve more serious issues around bereavement, depression, or family conflict. For many callers, that conversation really provides an essential moment of connection, and it reminds us that sometimes the most powerful intervention can be listening. And the third project that I'm going to speak about is our project called Age Well. This is another program that really demonstrates the value of a community-led model. It's a peer-to-peer support project again, where trained volunteers provide well-being checks and regular contact to older people living in the community. The project's focus is to support people to remain living well in their own homes for longer, something many people we found strongly value. The model begins with a well-being check, and it's followed by regular weekly home visits from a trained volunteer companion, along with follow-up phone contact where needed. And it's this kind of early preventative support that can play an important role in helping people maintain the independence and well-being. And the impact of this approach is particularly visible for us in rural communities. This project works in County Meath, which is quite a rural space, and 55% of Age Well clients live in really rural areas, often very small townlands where access to transport services and social activities can be limited or often non-existent. Many of our clients are also in groups that are most at risk of isolation. So 76% of our clients in Age Well are over the age of 80. 2/3 live alone, and most are widowed. Through these regular visits and contact, volunteers help reduce loneliness, rebuild confidence for our clients, and connect people with local networks such as neighbours, parish groups, and community activities, and where needed, referral to health services. The outcomes of this project are really significant. Clients show a significant improvement in mental well-being within 4 months, alongside reductions in loneliness and improvements in social support. And the strength of Age Well, again, a common thread through all of our projects, is that peer-to-peer and volunteer approach. This, we find, creates real trust and understanding, helping people remain connected, confident, and really supported in their own homes. So to conclude, when we look at all of our programs together, we see that they do more than just deliver a service. They really help rebuild the social fabric of these communities by creating that space and opportunity for connection. And I think one of the speakers earlier mentioned, these things don't happen by accident. Those spaces need to be provided, those opportunities need to be created. And in rural communities where we see in Ireland, formal services are often really limited, this kind of network becomes incredibly important. And they often complement local services too by providing that kind of informal support and connection that maybe more formal systems just can't provide. In this way, they really act, we find, as a form of social infrastructure, connecting people who might otherwise have become isolated and really strengthening the everyday community life. And at the centre of these networks, in our experience, are older volunteers. One of the most important lessons from our work, and I'm sure all of our work, is that ageing should not only be viewed through that lens of need. And what we see every day in third age and across Ireland is enormous potential of older people as contributors, teaching, mentoring, welcoming, and supporting their neighbours. Through our projects, we find that when older people are fully trusted and supported supported to contribute, they really strengthen the cohesion of communities. And as our societies continue to age, recognising and mobilising that contribution, we feel may be one of the most important ways that we can build more connected, inclusive and resilient communities as well. So thank you,
Claire. Thank you, Claire, so much. That was also very inspiring. We've received a lot of comments and questions, so I've tried to summarize them and I've had to make choices. So I'm going to ask one question to each of you, taking a bit of a summary. So to you, May, how did you manage, or how are you managing to reach this sort of hard to reach group? Maybe you have to fight strong self-perceptions and maybe some gender stereotypes. So we'd be curious to know about that. Mariana, how does distances influence your activities, knowing that often people are scattered around and there are some challenges with public transportation? And to you, Claire, there was one question on how do you integrate cultural, moral, and religious aspects while initiating such initiatives? And when you do, what are the steps that you follow? May, I'll give you the floor. We basically have 5 minutes, so sorry for that, but yes, May, go ahead.
Okay, so yes, I also look at those comments and maybe about those stereotypes. I think that at the beginning, in the initiative group, we really looked into those stereotype topics. We tried to better understand them and acknowledge them, but in our current activities, we are not kind of making that so brightly out of the actions that we would focus on the stereotypes. We are not kind of outlining them. But I think that the stereotypes are kind of in the back of those activities. For example, when we think about that, well, usually the women are those one who come together and just talk. But now we are bringing men together and make them talk to each other. So this is something that how we are really cracking the stereotypes or trying to change that, but we are not saying that out loud. So this is something we are not doing. And what I would like to also add is that how you communicate events and how you invite the people to come to those events is very, very important. And this is also something that we agree together with our initiative group, because the men really know what really inspires them, how different kind of messages really influence them, and how we should set up for example, the text set, how we invite the men to participate. So I think this is something that is really important here. And last but not least is that the personal contact and the personal sharing of this event. Our men in our initiative group also, they share the information. They ask the people to come, not aggressively, but just this is something that really grows the trust against those actions. This is not something weird we are doing, but this is something very normal, and it has a quality mark through those initiative group men that we have together with us. I hope it responded to the question.
Thank you very much. Mariana, on the question of distances.
In fact, it is one of our biggest challenges while working in a dispersed rural territory. Our villages are small and very far from each other. So our team is constantly traveling across the municipalities, carrying all the stuff and the equipments with us that are needed for the activities. And we also have to make sure with the local teams that we have suitable spaces for prepared for host the activities, sometimes in parish councils, local associations, or even unused community buildings, but bringing the activities closer to people is essential to reduce these barriers and to try to overcome these issues with transport.
Thank you.
That's it.
Thank you so much. And Claire, on the question of differences, there's also a question for you. Who maybe you can also tackle this. Who is responsible for implementing the programs, public or private entities?
Yeah, so I'll start with the first question. So absolutely, there is many different cultures involved in a Falchus shock group. And as I said, we have hundreds of them across the country, over 260 locations. Really how we approach that is we first of all make sure that our volunteer tutors have loads of opportunity to learn about different cultures before they go in volunteering. So we do things like cultural consciousness, understanding unconscious bias, training events for all of our volunteers, none of which are compulsory, but we really do encourage our volunteers to inform themselves as much as possible. And these cultural trainings are not sort of a list of do's and don'ts, but they're about people exploring their own biases, their own perspectives. We also do trainings around trauma-informed practices. So a very high number of our learners at the moment are coming from conflict or have fled persecution or have experienced trauma recently or indeed experienced it in quite real time. So we make sure that our volunteers are aware and up to speed working in that kind of environment. So we have a very streamlined package, I suppose, for Falchus Jock, where the model can be rolled out in any community, and we provide that support. We also include things like group agreements. Again, this is about individual tutors working with small groups of learners and agreeing to an open space in that Falchus Jock group. So it's very simple things, but we translate these as well for our learners around, allowing for people's opinions, making sure that people feel comfortable, things like that. But to be honest, Falchus Jock works very well, I think, because it is an open door space. So, for example, you have a community space. Every single learner that comes there because they want to. So there's no form checking or reason that they have to come to a Falchus Jock other than that they want to come and they want to improve their language and they want to meet local people. And the tutors and everybody involved is a volunteer. There's nobody paid within Falchus Jock in each of those groups. So it creates a very open door. It's always free. It's always accessible. It's very drop-in, very informal. And I think that really creates a space and an environment that's about sharing, that's about learning. So people do share about their cultures. They discuss moral differences, religious differences in a very open and calm space. And it's a very positive learning space. So I would say that. So hopefully that answers your question. And then the other question, implementing these programs, public or private entities. So I think in terms of Falchus Jock, how it works is, as I said, Third Age has quite a streamlined project. We reach out, or often we'll let communities come to us first, say, look, there's a need in our community. There's lots of new people living here. Can we start a Falchus Jock? We go out and visit them, and sometimes that's an established community organization. So it might be a family resource center or another type of community organization that's working in that area. Other times it's just a person in the community, just a volunteer. We go out, we train the groups, and we support them that way. We give them all the resources for free. We provide ongoing training. All they need to find is their venue. And like I said, everybody gives their time for free. So it works very simply in that way. I'm not sure if that answers the full question. In terms of how we're funded, it's a mix of public funding and private, but
Thank you.
It's community led, I suppose, is the answer there.
Thank you so much, Claire. We are unfortunately running a little bit late, but please do feel free to continue the conversation in the chat. Thank you so much, Claire, Mariana, and May. This was really interesting and inspiring. And we now will give the floor to Giulia Lanfredi from Eurocarers, which is the European Association working for carers. We thought it would be nice to tackle another key aspect of the aging ecosystem, which is the role of carers in community building. Giulia, the floor is yours.
Thank you very much, Alexandra, and thank you for the invite, and thank you for the great presentations beforehand. This was really inspiring to hear all the work that is being done. Yeah, as Alexandra mentioned, I represent EuroCarers, which is a network of both national and local level associations that are supporting informal carers across Europe, both in a research capacity and in a carers-led advocacy capacity. And our work is to try to advocate for the rights of those that are providing long-term care outside of a professional framework, and also to make sure that care inclusive policies are passed both at local, national and European level. But what do I mean when I'm referring to carers? You might have heard the terms carers, informal carers, family carers is also another term that is sometimes used in different contexts. And what we mean by this is, for example, an adult child taking care of an older parent living with dementia, or a spouse taking care of their partner that has a long-term disability, or also a parent of a child with a complex disability. So these are all situations that are connected by the act of taking care of someone outside of the professional framework, and also usually in an unpaid manner. Normally, in the majority of the cases, carers are family members of the people that have long-term care needs, but that is not always the case. Also, friends, neighbors, and community members can sometimes take on these caring responsibilities. So I think this is another thing to keep in mind, that the community element can be really present, especially in rural areas where communities are very tight-knit and connected. Why are we talking about carers? Well, informal carers represent one of the main parts of our long-term care systems today, not the only part. Also, formal and professional services are part of these ecosystems. But at the moment in Europe, it is estimated that informal carers are the ones that do provide the majority of care, around 80% on average. So they are at the moment the backbone of our long-term care systems. And without their role, lots of people will not be able to receive the care that they need, because the formal services are not able to meet all the needs. Obviously, there are huge variations depending on which part of Europe we are talking about. But on average, this is the situation in Europe. And I think the role of carers is very interesting and even more prominent in rural areas. This is because, as it has already been mentioned by other speakers today, people living in the rural areas sometimes have some barriers in accessing health and social care services. For example, something that has been said before already, sometimes people have to travel long distances just to reach a pharmacy or their GP, or also a hospital. So this is really the reality of lots of people living in these territories. And we hear a lot from families that we meet in our work that even though sometimes they are entitled to having access to professional support, they have the entitlement, there is even the budget sometimes, there are very long waiting lists, because the services do not reach all the territories in an equal way, and also because sometimes it's really a matter of having a hard time finding professional staff that is able to live or to travel to rural areas. So there is this gap between rights that families have and what they're actually able to access. And that is where carers living in rural areas have to step in even more compared to what they do in other more urban areas where there is better access to services. All this puts additional pressure on carers. So this is something that we have to keep in mind. We know there has been extensive research done on the caregiver burden. What are the consequences? What is the impact on the carer of this heavy workload when they are left to face it alone? And that is the key point. Care is not a bad thing per se. It can be a very fulfilling and enriching experience. The difficulties arise when there is no support, when carers are left alone, and when they have no one to rely on, or even to just have a little break sometimes. So this is another important element to keep in mind. Another very interesting thing that has been mentioned before and that I wanted to go back to is the fact that rural communities are aging at a faster pace compared to urban ones, because lots of the younger generations are leaving to seek job opportunities elsewhere. And this has implications also for the provision of care, not only because long-term care needs are growing faster in rural communities, but also because the carers themselves are sometimes older adults. So this aging element is present on both sides of the care relationships. And so all this being said, I think it's really important for all of us and for our work as well to really make sure that policy making and advocacy efforts are able to really tap into and consider the specificities of people living in rural areas, to really bring this a bit more to the front when having these conversations. Recently, the European Commission released the EU Strategy on International Fairness, which explicitly mentioned the fact that there should not be geographical differences in the way people experience aging and their intergenerational relationships. So this is a strategy, that is what we are aiming for, but there is still a long way to go before we are able to live this reality. So basically, to come towards the end of my intervention, I wanted to bring a couple of questions to the table, which is how do we ensure that people can continue to receive care within their communities of origin? This is an important point because we cannot automatically default to moving people from rural areas to urban areas when they need more assistance. We need to find ways to provide care where people are so that they can remain in connection with their communities. And also, how do we make sure that when designing interventions to combat social isolation, we keep the needs of carers in mind, because sometimes when informal carers are alone, they do not have access to support. They can be socially isolated from their community, from their friends, from their families, because care is a very demanding task sometimes. It's really 24/7 around the clock, no breaks when there is no official support. So it's important to keep this in mind, that carers also need to be considered when designing these interventions to reduce social isolations. And yes, basically, just to conclude with this idea that we have to strengthen our communities, having in mind both those that need care and those that provide care, not only because of what the reality is today, but also because of what are the changes that are coming in the near future. So yeah, I hope this was clear, but happy to answer any questions if there are any, and if we have time. I know we are a bit late.
Thank you so much, Julia. Yes, I love that you brought the policy spin to close the seminar, the webinar. So thank you very much. I think we've put the link to your carers in the chat. If we have not, we will do now. I would like to thank all of our speakers today. And before I say my closing words, I think my colleagues would like to take a photo. So please, let's do it now, maybe. I don't know who's managing this, but let's do that now. Tell us when to smile, Mader or Marisol.
You can smile now. Turn your camera on, please, if you can. 3, 2, 1. Thank you.
Thank you so much. Yes, so thanks again to all our speakers for the time you put into preparing for this and the time today. Thanks to the amazing ELIF and ADL team, Marisol, Yulen, Delia, Mader, Julian, everyone on the team for all the support and the interactions. I would like to say that we have a few steps that we can mention now in the SERIGO project. Yulen mentioned the steps in ELIF. We have, of course, invited you to become a member of our community of practice if you're not. And we have our next webinar happening on the 6th of March, which will be quite hands-on with breakout rooms exercises to better understand the notion of intersectional vulnerabilities. And we will have a specific focus on access to women's health in rural areas and a particular reproductive health. So we hope to see a lot of you on the 6th of May. And thank you again for all of you that joined today, and see you soon. And yes, we'd love to hear your feedback. Please take the survey in the chat if you can. Maybe now it's the easiest. The survey link is in the chat. Thank you again.